It's Monday, September 27, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to look at a really neat study that comes to us from Japan. It was accepted in 2005, and it's entitled Changes in Leukocyte Population After Ozonated Autohemoadministration in Cows with Inflammatory Diseases. So we're looking at how ozone therapy may affect inflammation and affect the immune system in cows in this particular case. So I think this is very relevant, especially for veterinarians who are interested in moving away from antibiotic use and the over-administration of antibiotics to something like ozone therapy, which gets to the root cause and helps the immune system function more efficiently. So, in fact, they say something to that effect right here when they say clinical cases of inflammatory diseases are found frequently in lactating cows. These cases are generally treated by administration of antibiotic drugs. However, social awareness of food safety issues involving livestock treated with antibiotics has grown in recent years. And as a result, veterinarians need to investigate alternative treatments for inflammatory diseases that do not rely on antibiotics. I would go one step beyond that and say it's important not only because people now are recognizing it's a problem, but because it was always a problem. And we need to be able to get to root issues instead of using a pill or an antibiotic of some sort to treat the symptoms of what's going on there. So what did they do here? Well, they took blood from these cows and they treated it with ozone, and they took a sample and they looked at it before they treated it, and then at day 1, 2, 3, 4, 5, 7, and 14 after the treatment, to see the parameters in the blood and how it was affected by the ozone. I want to jump down right into this area and look at how they treated it. A blood volume of 25 milliliters to 100 milliliters was insufflated with ozone at 10 micrograms per milliliter, so fairly low concentration of ozone. And then we're going to, they looked at different parameters in the blood and how it reacted, but we're going to jump down past a bit of that. Jump down actually to the last page in this particular study and just take a look at their conclusion. This would be a real quick look this week. In conclusion, the data obtained in the present study showed a significant difference in changes of lymphocyte population between the inflammatory and control groups after ozone therapy. And this process appears to be related to inflammatory response. Bocci reported the exposure of blood to appropriate ozone concentrations is effective in humans, and that neither acute nor chronic side effects have ensued in millions of patients treated with ozone therapy. It is possible that an unexpected immune response is induced by ozonated autohemotherapy in cows with inflammatory disease. Therefore, specific studies investigating the effect of ozone therapy on immune response must be designed to determine whether ozonated autohemotherapy is effective in activating the immune system in cows with inflammatory diseases. And we've seen a lot of studies since this time, 2005. So we've had a lot of years now to do more and look at more. And I think the verdict is quite clear that ozone therapy indeed does have the effect that they're talking about here to stimulate the immune system to really get to the root of these inflammatory issues that are happening. So there you have it. That's a look at ozone therapy and inflammation and the immune system. It was really quick, but that's all for this week. We'll see you next week with another installment of 5 Minutes of Proof.